And as vaccine appointments keep getting delayed, the big question we all want to know, when will there be more supply? Now, experts say that is hard to predict, and that means it is a waiting game for people at the top of the priority list. WJZ is live tonight and new at 11 o'clock. Rachel Menentoff explains why there is so much uncertainty right now. Rachel.
Rick, we spoke with a Johns Hopkins doctor today who says there are scheduling problems on the federal, state, and county levels, and these problems will only be fixed with time and a more stable supply of vaccine. 2 million Marylanders are now eligible to get their COVID vaccine, but only 11% have actually got one, and that's because the supply is so low. When can those people expect to get their first dose, many of whom are have been waiting a long time?
It's very difficult to know exactly when someone can get their first dose. We know that states are ramping up the availability of appointments and vaccinations, but it is a very rocky process.
Dr. Amish Adulja with the Johns Hopkins Center for Health Security says there isn't a centralized approach, and it will take time and transparency to overcome the rocky rollout. This has led to problems across the state, including one example he gave us where people were turned away because of online links that allowed appointments to be overbooked.
Everything right now I feel like is a little bit slow, a little bit delayed.
And it's a huge undertaking, to get that out. You're talking millions and millions and millions of doses.
Dr. Adulja says getting a COVID vaccine should be as seamless as getting a flu vaccine. But right now many people are feverishly checking multiple websites and hearing through word of mouth where they might be able to secure a shot.
It's not easy to predict when someone will get a vaccine, even if they are high on the priority list, because there is so much uncertainty about supply and where to get a vaccine, and also how much effort a person is willing to put forward to get a vaccine.
Dr. Adulja says he's hopeful that once the Johnson & Johnson vaccine is approved, that it will increase the flow of vaccine, and he predicts that it will be well into the summer before we reach any kind of herd immunity. Live tonight at Johns Hopkins University, I'm Rachel Menentoff for WJZ.